everybody. This is Dr. Annette Feravich with Healthy Mind, Body, Spirit. And as always, you can find me on the internet at www.healthymindbodyspirit.net. Okay, just getting a little bit adjusted here as I usually do. Getting on late as I usually do. But I am ready and we are going to get rolling to present to you today's topic. Now remember, this is a topic on it, and by the way, tomorrow I'm dressed up a little bit. Happy Valentine's Day for tomorrow, everybody. Okay, so as you know, this is actually episode number 7 in my series. And so what am I doing for this series? Well, this series is A Healthy New You in 2022. Oh, not autism though. As I'm scrolling through there, I'm going through actually some of these slides that have to do with this as well. But I'm talking about health and thyroid health today. And so what I want you to pay attention to is, seriously, I took it off of there. That's okay. What I want you to pay attention to is that we are trying to address and change our healthy habits. So that's really what I am all about, is taking a critical look at what are healthy habits, and then what we can do to make sure that we are healthy and that we are staying healthy. And so I'm starting this year, 2022, A Healthy New You, with talking about a healthy body. Now, you might wonder, and I kind of want to give you a little bit of information on this, you might wonder why it is that I can give you some information, being that I major in psychology, and in particular in cognitive, social, and developmental psychology. Why is it that I can give you some advice on your health? And not only that, obviously talk for hours about giving you advice on your health. Why is it that I can do that? Well, the reason why is because what I actually have expertise in is positive psychology. And positive psychology is under the umbrella of social psychology, which is actually also under the umbrella of health psychology. What are our outcomes of interest all the time in positive psychology? Our outcomes of interest are health and well-being. And so what we do is we look at those behaviors that are associated with good overall mental and physical health. That is our well-being, all right? And so why is it that we don't limit it then to our area of expertise? Why don't we just limit it to mental health? Well, the reason why is because so much of our physical health has to do with our mental health. As we've seen in this series, in episode number 2, I talk about the importance of vitamin D. And if we are feeling blue, if we're feeling lethargic, if we have low energy, the very first place we want to start is taking a look at whether or not we have enough vitamin D. And if we are above that line that I talk about in that, find out, go ahead and look at episode number 2 to find out, are you north or south of the region that really always needs to be supplementing with vitamin D, except for at the real high sun noontime in the high summertime as well. Okay? All right, so we know, and even things like stress that I'm going to talk about today, that there are ways that traditional medicine approaches things like stress and those things that they study that are associated with stress, and there are things that traditional medicine simply doesn't look at when we're taking a look at stress. And so my approach is much more of a naturalistic approach. It's a much more of a holistic approach. So of course, that's the name, Healthy Mind, Body, Spirit. So that's what I want to do is I want to, at every step of the way, demonstrate to you the importance of that um, synergy between those three elements of who we are, those three important elements of who we are. And so today, what are we talking about? Well, today we are talking about the thyroid. And this really has, it's not the thyroid. There we go. I can't see very well. Okay, and a lot of this, some of this I've gone over in some of the other videos that I've talked about when I've talked about depression and stress and anxiety and loneliness. So take a look at some of those other videos if you want a little bit more information. But we know that the thyroid has gotten some great attention, and not for any really positive reasons, right? So this is not not so good of a reason that we gotta look over there to see, because my connection, thinking about plugging in, but it's difficult for me to do. Okay, and half the time doesn't matter. Xfinity, I don't know why sometimes I end up getting, this is what I want to do. I don't know why I have problems with my connection over here, which I really shouldn't have. Okay, anyway, moving on though. So the thyroid has given us, we've had a lot of attention on the thyroid and thyroid issues. So today I wanted to take a look at what is the thyroid, and because it has to do with our adrenal glands, we need to talk about that, and because all of it has to do with stress, we need to talk about that. So we're going to highlight some of the thyroid conditions, the way that the thyroid works. So what are we going to talk about? So first of all, we're going to talk about what is the thyroid and how does it work. And then we're going to also talk about some of the ailments or diseases that are associated with the thyroid. Then we're going to talk about the adrenal glands. What are the adrenal glands and what do they have to do and how do they relate to the thyroid? So we're going to talk a little bit about activating our adrenal glands as well. And then finally, what we're going to talk about today is we're going to talk about how does that relate to stress. Okay? All right. So let's talk about, first of all, what is the thyroid? And I want to tell you that there are sites that I have gotten a lot of my information from, as well as just because these are some of the things that I study as well in my practice and in teaching at a local university that is neither associated with this or endorses what I do here. Okay, but I will have some of those references in our in YouTube underneath. So remember, subscribe, like, share, and take a look at underneath there some of the links that I have for where I got some of this information from. Okay, so first of all, the thyroid is a gland. And the thyroid is a gland that is part of our endocrine system. So I think what I'm going to do is take a look at that. And here you can see our endocrine system. And our endocrine system is also known as our hormonal system. And when we're talking about our hormonal system, we are talking about chemicals that are found in our bloodstream. So how does this all work? Well, what it does is there are two systems that are activated when we are moving through life, right? For whatever reason, because we have to get our bodies moving, and we also have to get the chemistry moving in our bodies and in our brain. And so we have these two systems that are connected. The first system here is our central nervous system. And our central nervous system contains a peripheral nervous system. And part of the peripheral nervous system then has to do with all of the information that goes from our brain down through our spinal cord and then off into the sensories or senses, right? So sensory information that is sent to and from the spinal cord. So not only does the brain then send information down the spinal cord to these other areas of the body, but also the areas of the body send information up through the spinal cord into the brain. And even sometimes we can actually have enough information to, for example, pull our hand back from a hot stove without that information ever getting to the brain. And so this is a really sophisticated system that we have. What happens in our brain is, in the center here, near the center of our brain, what we have is an area that is called the hypothalamus. And the hypothalamus is activated as part of our brain and spinal cord central nervous system, but also you can see here that it is key in the endocrine system. So the hypothalamus is activated, and in doing so, what we have is we activate then the pituitary gland, and you can see there then there's the thyroid and the parathyroid glands that are right there near your throat and right along the collarbone there. So wrapping around your spinal column right there at your neck. And you probably recognize this because the doctor very often checks this. When you go in for your regular checkups. So when you go in for your annual physical checkup, if you usually go to those, what the doctor will do is they will go and they will check to see if there's any swelling in your thyroid. And also, when you have regular blood tests, those regular blood tests also check for your thyroid hormone. Now, let's talk a little bit about what ends up happening then. So what happens is that when there is an imbalance in the body, and typically that imbalance comes in from the central nervous system, right? So an imbalance in the body, my finger got burned. An imbalance in the body, I feel hot and sweaty. An imbalance in the body, I don't know why that keeps shaking. An imbalance in the body, I'm full. I feel full. An imbalance in the body, I feel tired, right? So these imbalances are picked up by the brain in the hypothalamus. And then what that does is it signals to the pituitary gland that we need to get some hormones going. Now there are other signals that are in the central nervous system that gets our body going, right? But as we said, the endocrine system, which the thyroid is part of the endocrine system, gets our hormones going, and these are chemicals that are in the bloodstream. And so the central nervous system can get our body going very quickly, to get our legs and feet moving very quickly. A little bit more slowly, we end up getting the chemicals in our bloodstream. But even when you think about that, we actually get that chemistry going rather quickly, because when we see somebody, for example, that we're attracted to, we get kind of those butterflies in our stomach. Well, those butterflies in our stomach are part of the hormones that are beginning to race through our veins, so to speak, right? So in our blood systems. All right, and so the hypothalamus, there's an imbalance, signals the pituitary gland, which is considered the master gland. And the master gland then says, who do I need to signal to? Do I need to signal to my liver? Do I need to signal to my adrenal glands? Do I need to signal to my thalamus? Where do I need to signal? And then we go, and then that activates, then the pituitary gland then activates the appropriate other gland. And so what the thyroid is considered is a secondary gland. Why? Because it's activated through other processes. It doesn't directly then decide to excrete thyroid hormones. It is done through a series of other connections that are indicated through imbalances in the body. Okay, all right, so knowing this then, what else do we want to know? Well, what the thyroid does. What does it do then? All right, so the thyroid, I like to think of the thyroid as our steady flow throughout our day. So the thyroid provides energy for us, is what it does. It helps provide energy. And the thyroid then, because it helps us provide energy, is associated with body temperature. It sets the rate at which cells burn energy. So this is our metabolism. So the thyroid is responsible for getting rid of sugar, carbohydrates that we have, and fats. And those are energies that are stored up within the cell. And so the thyroid says to release that. It helps us release or metabolize and keep a balance with our body's needs for energy and actually expending energy from the cell. Okay, it also therefore then has a lot to do with weight. And so we'll see that when individuals have thyroid problems, that they also have fluctuations in weight as well. We also have probably heard of a lot of diseases. We'll talk about those in just a minute. We also know that this has to do with regulation of our reproductive cycle as well. So it provides energy for ovum and for the sperm. And very often when individuals are having problems with getting pregnant or pregnancy, we can often check to see if there is a thyroid problem. Weak thyroids often is a sign of trouble getting pregnant. Okay, it also affects, so the thyroid also affects our mood, of course, because those things, regulation of things like energy, is going to have something to do with our moods as well. We see that thyroid issues are more often found in women than in men. 80% of women end up having thyroid issues. And also this is associated with later heart problems, including problems such as hardening of the arteries. We also see that obesity or overweight, individuals who are obese or overweight have to do with imbalances in the thyroid. We also know that mental retardation in children may have something to do with imbalances in the thyroid in the mother. We also know thyroid issues have to do with depression. When we have hypothyroidism, so hypo, that is an underactive thyroid, this can have to do with swelling around the brain, and we can also see then hypothyroidism is associated with what they're calling now is Thyroid Eye Disease. And so we're going to use this as a specific example for the differences in the way that traditional medicine approaches disease and the way that somebody like me or other people who are naturopathics or holistic providers, healthcare providers, would approach something like a thyroid disease. Also, I want to draw your attention to the fact that the differences that I'm going to help highlight are differences that we see between treating a symptom. So this thyroid eye disease, where we have bulging eyes, has to do with inflammation that is caused due to this is an immune problem, so immunological issue or an immunological problem. So what we are seeing here is that our immune system is actually attacking the thyroid. And so this is an immune problem that we have, or an immune disease is what we know, and this immune disease results in inflammation, and the inflammation results in swelling around the brain, and we see this with the swelling of the eyes. Again, what they're calling thyroid eye disease. We also know that I think maybe, let me see here. And that a lot of thyroid issues have to do with iodine deficiencies. Okay, so let's just take a look at a little bit more about distinguishing, and I don't necessarily want to go into some of the specifics of hypothyroidism and hyperthyroidism and some of the diseases that are associated with it. What I want to do is I just want to brush on some of those diseases. But first of all, before I do that, let's talk a little bit again about the thyroid and what the thyroid does for us. So the thyroid activates when we are going about our normal day. And so our normal day requires activation and motivation for us. For example, if we're tired, we need to be motivated to actually get some sleep, right? If we're hungry, our body needs to be motivated to get some food. If we wake up in the morning, our body needs to be motivated to get up and get out of bed. These are just very normal activities, and that's what the thyroid is responsible for. The thyroid is responsible for getting our body and using the energy in our cells appropriately so that we can get our body just ready to do normal tasks throughout the day. Okay? All right, and so sometimes then what ends up happening is our thyroid gets either overactive or underactive. So in either case, of course, what we know is that this is going to cause dysfunction in our body. And so we're going to see then dysfunction in all those areas that the thyroid is associated with. So areas such as weight, areas such as body temperature, areas such as mood, areas such as even things like brain fog, for example. So the two differences, and things also like dry skin, muscle weakness, hair loss, feelings of apathy. So when we have an underactive thyroid, this is called hypothyroidism. And again, we see this in about 80% of individuals have hypothyroidism, and overactive thyroid is hyperthyroidism. And so what do we see? An underactive thyroid is also associated with Hashimoto's thyroiditis. Hyperthyroidism is associated with Graves' disease. Okay, so what is Graves' disease? Let's start with that. So, first of all, these thyroid diseases are autoimmune diseases or autoimmune disorders. Graves' disease is a disrupts our antibodies, and it also disrupts what is called our thyroid stimulating immunoglobulins. And so what these are is they have to do again with they cause the cells to work overtime. And the antibodies in the Graves' disease, what they do is they bind to these thyroid cells and stimulate the thyroid cells to overproduce thyroid hormones. The result is an overactive thyroid or hyperthyroidism. Hashimoto's disease is basically also the opposite of what we see, or the symptoms are the opposite of what we see in hyperthyroidism. And but it is also an autoimmune disorder. Okay, and what this is it involves chronic inflammation of the thyroid. And then this condition tends to run in families. And what it does is it impairs the production of thyroid hormones. And what this does is it leads to a gradual decline in the function of the thyroid, and it eventually becomes underactive. We know that our thyroid becomes underactive as we age. And so, of course, this is something that we want to be aware of as we're aging. So we want to pay attention to changes in our thyroid. So how do we measure to see whether or not we have problems with our thyroid? Well, there are a couple ways to measure. But first of all, what you want to be aware of is that when you are getting your thyroid measured by a doctor, your traditional doctor will typically only measure what is called your thyroxine, or what is called your T4. Your thyroxine is your slow activating hormone, and this is basically what wakes up your system in the morning. That is typically what your doctor will measure, but they will not measure, for example, your T3. And what your T3 is a faster activating hormone, and what this is T4 converts into T3, and this is actually, this T3 needs to be measured as well, because it is the T3 that naturally declines as we get older. And this is then a pituitary function is what it is. And so doctors have sometimes difficulty in knowing what to do with a problem pituitary gland. They can figure out what to do with the problem thyroid, but they can't always figure out what to do with the problem pituitary gland. So that's often why you might need to go to individuals who don't just look at your body in a traditional way and then easily write prescriptions. I want to show you this and what we see as far as diagnoses goes when it comes to some of the glaring differences between traditional medicine and their approach to thyroid disease and naturopathic doctors or holistic practitioners, I'll call them. All right, some of their approaches. So let's take a look at just what is the treatment now that they are taking a look at, that traditional medicine is taking a look at when it comes to treatment for what they are calling thyroid eye disease. And they are also then distinguishing thyroid eye disease from Graves' disease, for example. Okay, and so how they are distinguishing these is they are saying that they are both an autoimmune reaction, right, or an autoimmune disorder. However, they are attacking different areas of the body. Where Graves' disease, according to the FDA and websites on which I will have for you, according to these websites on Thyroid Eye Disease and the pharmaceutical company that is treating this Thyroid Eye Disease, according to them, what they are saying is that the autoimmune disease is attacking two different areas. Where in Graves' disease, it is our body attacking our thyroid. What they are suggesting is in this thyroid eye disease that it is actually attacking the eye and the fat tissues around the eye. Well, this, in my opinion, is really a perversion of the information. Both are autoimmune diseases and both are related to thyroid conditions. And whether or not inflammation is in the area of the eye or whether or not inflammation is in the area of the thyroid, they are still caused by the same underlying conditions. And so what this is demonstrating for you is that traditional medicine is only treating the symptoms and discounting what is the underlying cause for this. So taking medication in order to reduce the swelling that is behind the eyes does not then recognize or address the issues that it has to do with your thyroid, with inflammation in your thyroid, and what if this is causing inflammation on your brain? And so here we see, and okay, well, let's say that, all right, well, we might say something like, maybe this medication, if it reduces inflammation and swelling behind my eyes, maybe that's a benefit to also reduce swelling behind the brain. Let's take a look at the side effects to this medication. The medication for this disease, again, which is thyroid eye condition, right? Thyroid eye condition. Okay? All right, so what are the side effects if I take this thyroid eye condition medication, which is called Tepeza, all right? And this you may have seen, I don't even care if I'm pronouncing that right. So you may have seen it, the commercials where the woman is walking through all kinds of wonderful places and she keeps taking off her glasses, right? Sunglasses after sunglasses, and now she no longer has to hide her bulging eyes, right? So is able to take off those sunglasses, no longer has to worry about the bulging eyes. Well, here it says the most common adverse reactions observed in patients who are treated with Tepeza are muscle spasms, nausea, alopecia, so this is hair loss, diarrhea, fatigue, hypoglycemia. Hypoglycemia is high sugar in the blood. We also know that high sugar in the blood is associated with COVID-19 and severe cases or high risk factors of getting COVID-19. So when we are talking about taking some of these medications for all that they are recommending for all kinds of things, know this. Number one, they are not treating the underlying conditions. They are only treating the symptoms. And so you will still have problems with the underlying conditions. And they are creating, in a very unnatural way, other side effects that can be extremely dangerous side effects or debilitating side effects. If you have a side effect of fatigue from this medication, and the thyroid also is malfunctioning in a way that's making you feel fatigued as well. Imagine how this might be debilitating when you're trying to get yourself motivated to work. and also what is being suppressed relative to that motivation. This is what is so dangerous when you end up getting pharmaceuticals and other medications that are not meant to treat the disease, but are only meant to treat the symptoms. And if you look at my last week's video, you will clearly see that disease in this country is getting worse and worse. So let's take a look at, and let me see if I've got all of them. I don't think I have all of them. Hearing loss. So these are more side effects to Tepeza, whatever it's called. Hearing loss, dry skin, altered sense of taste, and headaches as well. All right, so there are all the side effects in order to reduce the inflammation that likely is there in order to give you some kind of an alarm for what is going on in your bodies. So this is very dangerous kinds of medication, and I really do believe, and very dangerous kinds of science. And I really do believe that when we take a look back historically at both the science and the medicine that we are using at this point in time in our lives, I think we're going to look back and we're going to see really barbaric tendencies. We have seen where science and medicine have done terrible things in the name of science, and you can take a look at this for far more than things like the Tuskegee experiment. And we are going to find that this way that modern medicine is drilling into your head that you need to take chemicals in order to change chemistries in your body in unnatural ways. We are going to see, I really believe, in times to come, as that being just really primitive, just primitive, a primitive look at the body and all of the complexities of what is going on here. It's just a primitive look at it. Okay, all right, so moving on. So another disease associated with the thyroid is also thyroid cancer. Now, the thing about thyroid cancer is that there typically are not any symptoms. And the way that we find out that we have thyroid cancer is because there are nodules on the thyroid. And so what we do is we can remove the lobe of the thyroid. So we have 4 lobes there, the thyroid 2 and the parathyroid 2. So depending on where we have these kinds of nodules, we can remove that lobe. And the other ones very often can step in. And so what you see here in this chart that I have here for you is you see both the death rate across time for individuals with thyroid cancer, but also now what you see here is the increase in thyroid cancer. So the actual increases in new cases is what they're calling that. Okay, so increases in new cases compared to deaths. And we can see deaths all the way up until 2019 have not risen. But the increase in new cases, in particular starting here in about the 19, we see the 19, you know what, I have my glasses on so I can't see. All right, so that says 1996. And actually, this is some interesting information for you to kind of be aware of. What we see is we see significant increases in new cases of thyroid cancer here in the United States. But where don't we see significantly new cases and significantly new problems with the thyroid, such as hypothyroidism and hyperthyroidism, and also goiters, which I have not talked about. So let me mention goiters right here as well. So goiters also are are an outcome of thyroid disease. However, goiters really don't seem to interfere. So these, I'll have a picture up there when you go to my, when I have it edited. So I'll have a picture up there. But so goiters are, are like but almost like a tumor, but it's not a tumor, that is attached to your thyroid, and it grows and grows, right? So it ends up being a big bulge there. Well, goiters actually don't actually follow up with any symptoms. So individuals can have them. It's an enlarged thyroid, it actually is what it is, but many individuals don't have any symptoms. And what we realize is that typically individuals can get rid of goiters by increasing their what would be iodide. So what we don't have is we don't have enough iodine in our diet, but iodine actually has toxic principles to it, okay? And so what we need to take for increased amounts of iodine is actually iodide. And after World War II, Japan increased the recommendation significantly for their levels of iodine in individuals' diets. You can also get lots of iodine from, let's take a look at that. So foods that are high or rich in iodine. So we can see there we've got kelp or seaweed. And so lots of Japanese foods has kelp seaweed in it. And so they get lots of rich iodine from that source of food. Oysters also, so rich in the diet in Japan. Eggs, cranberries, yogurt. I wouldn't necessarily recommend getting my iodine from yogurt. Navy beans, strawberries, sardines, salmon, and cod, so fish such as those oily fish, turkey breast, baked potato, and pink Himalayan salt. So what we used to have iodine put in our salts here in the United States, and what you saw was a big decrease in thyroid related diseases, including things like goiters. But we also know that when Japan increased the recommendations for iodine in their diet, they increased those recommendations after the Hiroshima bomb. So after we dropped the bomb on Hiroshima, they increased the recommendations for iodine. This is because what we know is that nuclear fallout creates iodine deficiencies. And so this is interesting. We have increased our nuclear testing on the planet, and therefore we are increasing our nuclear fallout. So the expectation should be that we are seeing increases in thyroid diseases. Now, what we also should see then is increases in a recommendation for individuals to take iodine, or a form that we could take that's non-toxic, iodide. But we don't see that. And in fact, we have reduced the recommendation for individuals to take iodine and have iodized salt since the 1980s. And this is why we see that increase here in thyroid cancers, because we no longer have a recommendation that is a high enough recommendations for individuals to have iodine in their diets. Why have we taken that away? Well, one of the reasons why we've taken away that recommendation is because we have recommended that we lower our salt intake. And in recommending lower salt intake, what we've done is we've also reduced then our iodine, which we got through our iodized salt. So we've reduced our recommendation, we've increased nuclear fallout, so we've increased the reasons why we need more iodine in our diet, and what we've seen then is the increases in thyroid diseases that are associated with that. We also know, and across the United States, that thyroid cancer is directly associated with uh, iodine and iodine intake. We know that we can get more iodine from salt water. So, who is actually showing the lowest levels of cancer are individuals who live near salt water, including individuals, and in particular individuals who live in Florida. And you compare that, then the iodine that they're getting because of the salt water and probably other things, right, like kelp, seaweed, those things, and you compare that to a Montana that has some of the highest rates of thyroid dysfunction and thyroid cancer and has the lowest rates of iodine availability. So, something to really think about. Another thing for you to think about as well that I didn't mention is think about these, as I said, your central nervous system is also connected and sends signals to the rest of your body. And so if we don't have appropriate space in our spinal column between our discs, what we're going to end up having then is we're going to have problems. And if we have problems sending and receiving signals, and if we have problems with crushed vertebrae or discs that are fusing together or putting pressure on nerves, we can see there in C7, those are associated with our thyroid gland. So we can have problems there. We also see that C1 is associated with our sympathetic nervous system. It is also associated with our pituitary gland. And so here we are seeing then where signals might be unavailable to the rest of the body if we have problems with our spinal cord. So as I usually recommend, I recommend that you see a chiropractor, that you see somebody about the mechanics of the body. Often, as I've said, we hear scientists claiming a lot of things that they don't know about or that they really can't support with actual mechanics of what they're saying. What are the mechanics of what these doctors are saying? How does it actually work? And if we toss our hands up and we say, as many of the pharmaceutical companies are saying regarding these side effects, we don't know how we have these side effects. Take a look at my last video, episode 6, and I talk about some of the side effects relative to dopamine. And actually, I have some of those charts as well. Here, what this is these are the side effects to Tepezza. So there it is, Tepezza. And you can see here from their very website what the side effects are and some of the problems. And you can also see here that it says here, this is not a complete list of all possible side effects. However, this is Tepezza's website, and why it wouldn't be a list of all the possible side effects, I don't know. Because I don't know where else you would get a list of those side effects if you didn't get them from the pharmaceuticals website. Also, other concerns regarding pharmaceuticals are this, that they are becoming more and more privatized, which means that individuals are getting pharmaceuticals in the hands of private citizens. So, Mark Cuban, who owns, I think, the Seattle Seahawks. Yes, I can't believe I remembered that or knew that. Mark has the rights to some diabetes medication and is selling this for a reasonable price, while other companies who have the rights to other diabetes medications, or however it actually works between, all of those individuals who seem to be taking advantage of a system, are charging $1,900 for that same kind of medication. Well, that's what's going to end up happening to our healthcare system when we end up getting our medications in the hands of private citizens. And so they are able to bear the burden of the expense of marketing their medication, and those that get the most popular press, right, the most press out there, are those medications that end up getting and selling the best. We know this based on, for example, Prozac. And Prozac was an antidepressant that actually had the biggest and worst side effects, including suicidal thoughts and greater depression. And individuals, actually, historically, you can take a look at stories of mothers who did terrible things when they were on Prozac. Nevertheless, Prozac wasn't taken off the shelves despite some of these really adverse side effects, and the reason why was because it was popular by name. And so when we get these medications that are popular by name, we know that they sell despite whether or not they have really great negative side effects to them and debilitating negative side effects to them. Okay, let's take a look at I want to put up an image here that I didn't put up. Okay, all right. So here, in fact, I think that's exactly the way I'm going to show it to you, is just side by side, just like that. Get my face out of the way. And show you the side effects that we have here for benzodiazepines, or these are anxiety medications. And we also have side effects there that are listed there for antidepressants, and these are pretty common side effects for these. I also talked a little bit about them last week as well, and some of the side effects that we see here are for antidepressants: sexual dysfunction across the board for all antidepressants, headaches, say dizziness, diarrhea, weight loss and gain. And we don't see people losing weight on antidepressants. We see them significantly gaining weight on antidepressants, usually on average about 25 pounds. And I don't know how that could possibly make anyone less depressed. Benzodiazepines, so these again are anxiety medications. The biggest thing about these is that they are addictive. And I'm just telling you that I have a girlfriend who ended up getting off her Xanax for one reason or another, and it had to do with a sickness that she came. And while she was off of her Xanax, they went and decided to refill her prescription without her even asking them. And I don't know why they would do this, knowing that this is an addictive medication. So she was off of her Xanax for 3 months and doing fine, and they recommended, or they wrote her a prescription when she was over her physical ailments to get her back on. You can see here we've got low blood pressure, decreased sex drive, again, nausea, lack of coordination, disinhibition, depression, and suicidal ideation, again, unusual emotional dysfunction, memory loss, difficulty thinking, and decreased IQ. And remember, what are these? Well, they are the recommendations that are being made by your doctor instead of making recommendations such as, I always have to look, instead of making recommendations such as higher levels of vitamin D, being engaged in life so that you're actually naturally activating levels of serotonin and dopamine, setting goals so that you end up feeling the reward system, including reward hormones that are flowing through your body. That we also are engaged with loving relationships. How are those things being recommended through traditional medicine? And we have to be careful as individuals as well, because a lot of times what we do is we see something on TV and then we are curious about that prescription, or we're curious about whether or not we might need something like that, or whether or not our symptoms are dramatic enough to prescribe that kind of medication. And so sometimes we actually go seeking some of that medication out. And what we need to do more often is realize that the medicine and medication is in front of our faces constantly. They are advertising almost I don't want to say nonstop, more than almost any other field or industry. Pharmaceuticals are advertising. And also take a look at where they're advertising, right? On these major networks that are also now politically invested in pushing other pharmaceuticals. And so we really need to be much more skeptical about some of these things that we're taking a look at as far as how they affect our health in a much broader way. Okay, all right, so let's keep going here. I want to keep putting a smile on my face. Now, let me make sure that I have talked about everything, and I believe that I have so far. All right, so now what I want to talk to you about, as you can see now, is your adrenal glands. And so your adrenal glands now, let's talk about what they actually do. So you can see here that the adrenal gland is, first of all, sitting on top of our kidneys. And we saw this here when we saw the picture of our endocrine system. So our adrenal glands are also part of our endocrine system. And we can see here in a bigger picture how they're involved. Again, the adrenal glands are activated, so they are a secondary gland activated by the pituitary gland when the hypothalamus is imbalanced, when there's an imbalance. And so when do we feel an imbalance in our body? When the adrenal glands are activated. Remember, we feel an imbalance in our body and then activate the hypothalamus, and then activate the hypothalamus when there is an imbalance in our bodies. So what is the imbalance associated with the adrenal gland? Now I started to say, remember, hypothalamus is activates a pituitary gland when there's an imbalance in our body for our thyroid to be activated. But those are everyday normal occurrences, right? So I need to, every time that I need to go and change the size of these slides for you, I'm activating my thyroid gland because it's just a little bit of exertion, everyday exertion. I have to use a little bit more energy, a tiny little bit more, but that's what the thyroid regulates. So what do the adrenal glands regulate then? So let's take another look at that picture. And here you can see again, so here we've got the kidneys. So look like kidney beans. There's the kidneys, and you can see the adrenal glands are sitting on top of the kidneys. And then you can see that there's a little breakaway there of the adrenal gland, and you can see then there's the adrenal cortex, which is on the outside of the adrenal gland, and the adrenal medulla, which is on the inside of the adrenal gland. Now let me show you something. That when we are taking a look at adrenal gland functioning, this is what we see occur throughout the day. And so here, this is actually my adrenal hormones that were measured, and they used a saliva test in order to measure my adrenal hormones, or my cortisol is what they were measuring. And you can see here for cortisol, and this is what ends up happening to get our bodies ready. So throughout the day, what we end up doing is we end up secreting cortisol, which is our stress hormone, as soon as we wake up. So once again, our thyroid helps get us out of bed, but so does cortisol. So so we see a rise in cortisol to help get our bodies moving. And then what we do is throughout the day, as long as we don't have any major stressors, we see our cortisol levels significantly decline throughout the day. And then we see at the end, when we're ready for bed, our cortisol levels should be quite a bit lower. You can see this is me, I'm the patient in blue. I have a little bit higher levels of cortisol levels upon awakening, but you can see I follow the normal trajectory until I get at nighttime. So you could see that there's a little bit more of maybe stressful sleeping, a little bit more cortisol that I am releasing in my sleep patterns. And then this can indicate that I might need to take something. What would I take for that, and what do I take for that to make sure that my sleeping is just a little bit more relaxing, that I sleep through the night, and that it's a little bit more stress-free? I take Shaklee Stress Relief, which has ashwagandha in it. Now, ashwagandha helps us relax. What we do is we've got our, again, central nervous system moving in, which then raises our cortisol levels in our adrenal glands. And when we see these cortisol levels raised throughout the day, what we see is there's considerable dysfunction then between the adrenal glands and the thyroid gland. Why? Because what ends up happening when we experience over exertion and stress, that is at chronic levels, so that we are chronically worrying about things like COVID-19, about our jobs, about how our children are going to learn online, about the kind of grades I'm going to get, about whether or not I am making strong relationships with other people and anybody really cares about me, whether or not I'm in isolation, whether or not I have other diseases that I put on the back burner, or other health concerns that I put on the back burner due to COVID-19. And so we have extraordinary stresses during this time. And when we have these extraordinary stresses, what ends up happening is that's when our adrenal glands get dysfunctional. Why? Because our adrenal glands then raise the level of cortisol, our stress hormone, and keep it up there. And what that ends up doing then is it regulates all of our behavior, which dysregulates our thyroid. I begin to depend on and end up getting adrenal fatigue because I depend on my adrenal glands to get me up in the morning, where the thyroid was supposed to kick in before. I expect my adrenal glands to help motivate me to make breakfast, where the thyroid used to do that before. I expect my adrenal glands to end up stepping in when I am studying for a test, where the thyroid used to just take over in that area, right? I'm feeling the stress of all of that. So let's take a look at, again, how many times am I going to do that? This gland. You can see here then that the cortex, adrenal cortex, produces corticosteroids, or cortisol, which is our stress hormone. And what this does for us is it increases the metabolism of fat and our energy. So we said, again, what does our adrenal gland, our thyroid gets and helps us metabolize those fats? So does the adrenal glands as well. Of course, we need those fats, carbohydrates, and sugars in order to get our body ready for movement. And so that's what the adrenal cortex helps us with, getting the body ready and utilizing those things that we are retaining. It also inhibits antibodies, and it also regulates sodium retention, which also has to do with inflammation. Now, the adrenal medulla releases what are called catecholamines, and these catecholamines are epinephrine and norepinephrine. And what this does is it changes things like heart rate, blood pressure, breathing, digestion, pupil dilation. All of these things that have to do basically with some of the things in our regulating our central nervous system, like we see here on the right-hand side. And so those things that are not those things, but those hormones, epinephrine and norepinephrine, those adrenal hormones are then secreted, and they are at higher levels. Now, one of the things that these antidepressants do and anti-anxieties is that medication do is they are regulating epinephrine, and in particular norepinephrine, and they are preventing the reuptake of that. Well, what that ends up doing then is it ends up dysregulating things like our heart rate, for example. So in order to this is one of the reasons why we see as a side effect some heart issues that are associated with anxiety medication. Because what this is doing is it is dysregulating our catecholamines, or our responses, our fight and flight responses. Of course, that's what's changing in anxiety medication. But what we want to do is because this is disrupting our normal system of doing things, because it is focusing on symptoms very often and not the core reasons for this disruption in our thyroid and in our adrenal glands. We see traditional medicine is not utilizing some of these more natural ways that work along with your body. Okay. Let me show you. What is going on, and now you can kind of see how our stress that we have here in the United States ends up becoming chronic stressors that eventually end up affecting our health. So here, as we take a look at, this is a report that was put out by the American Psychological Association. They put it out on a regular basis, and you can see here, so they're taking a look at statistics that have to do with stress in America. And so here, right here, what we have is some of the reactions to this. Sometimes I am so stressed about the coronavirus pandemic that I struggle to make even basic decisions. And we see 37% of Gen Zs feel that way. 48% of millennials, almost 1 out of 2 individuals, are experiencing stress because of the coronavirus. Sometimes that they can't even make basic decisions. So this is extreme experiences of stress. Here we can see differences on strains on parents between 2019 and 2020 and 2021. So increasing strains for family responsibility, relationships, emotional support, doing enough to manage your stress, those kinds of things. What else do we see here? We see that there is a considerable increase in the effects of this pandemic on individuals who are minorities. They are significantly experiencing more of these not only risk factors, but also experiencing more death and experiencing more disease as well. We can see here also that sources of stress here listed. Work is a source of stress. We are seeing individuals who are going through what is called the Great Resignation. And some of these individuals going through this are then deciding to change their and disrupt their regular passion or their regular habits, so much so that they are willing to quit their jobs and have a complete paradigm shift when it comes to their careers and what they are getting out of life. And so some individuals are dealing with these kinds of stresses in very different ways. I want to put up another one over here for you. I put up the wrong one. Okay, sorry about that. I had to look this up, and I'm looking this up because these are the stats that I wanted to take a look at here. So they have a couple of these available through the American Psychological Association, but this was the one that I wanted to take take a little bit more closer look at. So you can see here we have got the individuals, for adults, and this is in 2021, that have an undesired weight change since the start of the pandemic. And you can see that most individuals here are reporting an increase in their weight gain, not a decrease in their weight gain. Some individuals undesirable weight loss, but most individuals have an undesirable weight gain. We also see here parents' mental, physical health has been impacted. 79% say they could have used more emotional support. 32% received treatment from a mental health professional, and 24% said they were diagnosed with a mental health disorder during this time. We can see here that 77% of mothers and 87% of fathers report sleeping more or less than they have wanted to. So changes in our sleep as well. Reported unwanted weight changes and report drinking more alcohol. 48% of men more so than they want to since this pandemic. We can see here 1 in 4 essential workers, 25%, have been diagnosed with mental health disorder since the start of the pandemic. And here we can also see that minorities are more likely to report concerns about their future than white individuals are. And we also see in many of these reports the stress again of this Generation Z that is experiencing more stress. Here, have experienced behavior changes in the past month as a result of the stress. 79% of Gen Z adults are saying yes, they have. 74% of millennials. What else are they saying regarding stress? Well, I had some other statistics. They're not right here. Okay, so what is the point here with all of this stress? So pointing out some of these statistics with stress that I pointed out before to you, what's the point of all that? Well, it's basically because I really need to turn on those other lights, which is really what I want to do. Okay, let's talk about then what should we be doing about all of this? Well, what we can be doing is, first of all, we need to make sure that we have our appropriate levels of our thyroid that are being tested. So again, if you want to take a look at I don't think I have the blood work up here any longer. Some of the my past videos where I show the type of blood work that you need to be making sure that they are testing your T4, your thyroid 4, and your thyroxine, and your thyroid stimulating hormone as well, T3 as well. Okay, so there's a whole panel for your thyroid. They need to be testing all of those things for your thyroid. You also want to be making sure that you have got appropriate levels of getting it in your food source or some other way that you're getting iodine in your diet. If you take a capsule form, it would be iodide is what you would end up doing, or a supplement form, you would be taking iodide. But you can get that, like I said, in Himalayan salt and some of your seafood, and you can also get that in things like eggs and kelp. And Shaklee has their alfalfa, and that's how you get lots of your iodine in your diet, through Shaklee product, through a supplement if you need that. Okay, and finally then, what are some other things that we want to take a look at? Well, what we want to take a look at is how we are taking a look at So some of the things that we really want to take a closer look at is we want to take a closer look at ways that we might be able to cope with our stress and adapt to stress. So here we can see that this is called a revised social readjustment scale, rating scale. And in this readjustment rating scale, what we have here is we give rates to both positive and negative events in order to determine how stressful an individual's life might be. Well, what we notice here in particular is this, that stressful life events don't have to be just exclusively negative events. Stressful life events can also be positive life events. And so what we need to do is what? Get rid of any change, any life event. Is that what we need to do in order to be able to cope or deal with stress? We can see right now what some of these changes as far as COVID might be giving us is it might be giving us skills that we might need in order to deal better with stress. So, what do we want to do in order to deal better with stress? What we would like to do is learn to reframe things not as threatening, but when it's not the best experience that we want to have, we want to reframe it as challenging. What are we getting out of that event? What kind of meaning and purpose can we get? We will all have trials, and it simply does not benefit us if we think that the best life is eliminating trials. It simply isn't. The best life is learning to deal with our trials in really positive ways, by getting meaning out of them, by finding purpose in them. Our trials are refining our skills so that when we have the next coronavirus, we are up and running with how to manage our children, how to have a better job, how not to be stressed as I'm going through my day, facing uncontrollable events as I always will. Let's take a look at this chart. And this chart is demonstrating some and I'll get you the site on this chart. But what it's showing you is the differences between a personality trait like resilience. So individuals could have certain personality traits that help them cope better. Is that really what is necessary to help us cope better, or is there something else? And what I hypothesize is that something else is perspective. And so here we look at the personality trait of low and high resilience. Does that make a difference in these two variables that are being looked at? Positive emotions or cardiovascular reactivity? What is cardiovascular reactivity? Cardiovascular reactivity is the amount of time that it takes for our heart rate to decrease after an event that makes it go like this, right? A fight or flight response. How long does it take you to decrease your heart rate after it's been increased because of an event? All right, so that's cardiovascular reactivity, and we're also looking for changes in positive emotions as well. So what we did was, what the researchers did was they had instigated a stressful situation. But what they did was they framed it differently. So they framed it for half the participants as a threat, and for the other half of the participants as a fun challenge that they might be able to really help improve their skills. And think of it as a challenge or a game, and let's see how well that you can do. Or you better get this done. It's really important, and a lot of people don't do so well, but it will tell me about your whole entire future. So a threatening scenario compared to a challenging scenario. See what you can do. And what we see is that there weren't differences necessarily in low and high resilience unless it came to perceiving something as a threat. We can see that when individuals perceived the event as a challenge, they both experienced the same high positive emotions, whether or not they were low or high in resilience. Our ability to bounce back is resilience, or their cardiovascular reactivity. We see that both the individual with low and high resilience came back and reduced their cardiovascular reactivity, their cardiovascular heart rate. They were able to reduce it as long as the task was framed as a challenge. But we see differences in much lower emotions for individuals who had low resilience when it was framed as a threatening situation. We also see that their heart rate stayed up for low resilient individuals when they had framed it in that condition in a threatening way. And so the best advice that I can give for you is, for adrenal problems and for thyroid issues, is first of all, remember that individuals are not experiencing the same rates of thyroid cancer when we have higher levels of iodine in our diet. So think about that first. Also make sure that you're getting all of your thyroid tested correctly, right? And I would also test your cortisol level, testing your adrenal functioning to see if that is dysfunctional as well. And then I would be thinking about some of those natural things that we've been talking about as your first defense before you go to see a doctor who is going to prescribe you medications that may or may not get to the core of the problem. They may just be treating symptoms and not the actual source of those symptoms. So take a look at some alternative homeopathic, holistic, naturopathic kinds of approaches to your health. So improve your vitamin D, first of all. Take a look at ashwagandha and take a look at the Shaklee's stress relief. Also, I would be taking a look at making sure that you are getting, for example, your baseline multivitamins. And also, I would recommend that you go see a chiropractor as well. So seeing a chiropractor will help you determine whether or not you are getting signals to the appropriate places in your body. All right, so these are some natural approaches to help you with thyroid issues as your very first defense. And it can also help you with adrenal dysfunction, and if you are experiencing things like chronic anxiety. Okay, so these are some of the ways that we think that we can help you. So this is Dr. Annette Feravich with Healthy Mind, Body, Spirit. And you can find me on the internet at www.healthymindbodyspirit.net. And so take a look at what I have out there now, and what I have out there and what I'm getting out there is my 7-day cleanse. So that's a great way to get your body started in the right healthy direction, because what it does, is it helps clean out your body of all of those toxins that keep building up over time. And I start with that every 6 months. I start with a clean cleanse every 6 months in order to get my body up and running for the challenges that I have. I know that that can really help my gastrointestinal tract to get me in the game. All right, Dr. Annette Feravich with Healthy Mind, Body, Spirit. And be sure that you check out my other videos on the internet and on YouTube, and make sure that when you see them that you subscribe to them, that you like them, and that you share them with others. Okay, have a great week and have a wonderful Valentine's Day.